Hello everyone and welcome back to our class of the face, and in this session we are going to study the facial vein and the lymphatic drainage of the face. If you look at the facial vein in this picture, you can see that the facial vein begins at the inner canthus of the eye, that is at the medial angle of the eye, as a union between this supratrochlear vein and supraorbital vein, and these two unite to form an angular vein. Now this angular vein, as it descends by the side of the nose, it takes up the lateral nasal veins from the lower eyelid, and then as you can see it passes underneath the zygomaticus major and comes down and further receives smaller veins communicating with the transverse facial vein, as well as the veins from the upper lip and the lower lip, that is the superior labial vein and the inferior labial veins. Coming further down, it receives the submental vein when it descends from the face into the neck. Not only that, you can make out that somewhere here in this region there is a vein which is passing deep to the masseter. This is the masseter muscle, so there is a deep vein passing here. This is the deep facial vein. It connects the facial vein to the pterygoid venous plexus in the infratemporal fossa, deep inside this region. Not only that, this supraorbital vein, either directly or through the superior ophthalmic vein, is in communication with the cavernous sinus. And again, this deep facial vein that goes into the pterygoid venous plexus, this pterygoid venous plexus passes up emissary veins through the base of the skull, some through the foramen ovale, some through the foramen spinosum, and these communicate with the cavernous sinus above. So the cavernous sinus, which is deep inside the cranium somewhere here, communicates with the facial vein from above through superior ophthalmic vein, and from below through the pterygoid venous plexus by means of this deep facial vein. That means this entire region of the face, consisting of the upper lip, adjacent part of the face and the ala of the nose, this is considered to be the dangerous region of the face, because any infections in these regions may pass either backwards through the deep facial vein or up through the angular vein, and it might infect the cavernous sinus, leading to cavernous sinus thrombosis and intracranial sepsis. However, let's follow the facial vein down. When it comes below the face and goes into the neck, round about the anterior border of the masseter, by studying the course of the facial vein, you can see that it's rather straight. It is not tortuous like the artery. However, the artery was somewhere here at quite a distance from the vein, and it is only at the anterior edge of the masseter that the artery and veins come close to each other. And you can also see from this diagram that the termination of the facial vein is rather complex. To understand that, we will have to study the veins of the side of the head. Here you can see that this is the superficial temporal vein with its frontal tributary and its parietal tributary, and when the superficial temporal vein is coming down, somewhere here deep from behind the mandible, you can make out that there is the maxillary vein. Here you can make out that there is a maxillary vein which is coming and joining the superficial temporal vein and forming over here the retromandibular vein. So for a short while you can see that the superficial temporal vein and the maxillary vein have united to form a retromandibular vein behind the ramus of the mandible, and almost after formation this retromandibular vein has split up into an anterior division and a posterior division. Again you can see that this anterior division of the retromandibular vein has joined the facial vein to form the facial vein proper. In fact, in older texts we would consider this vein to be the superficial facial vein and this to be the common facial vein. Now this common facial vein is draining into the internal jugular vein. What then happens to the posterior division of the retromandibular vein? this posterior division of the retromandibular vein is joined by the posterior auricular vein from behind the auricle, and these two form the external jugular vein, which as you can see is passing underneath the platysma and is about to drain into the subclavian vein. So this is the drainage pattern of the facial vein. It joins with the anterior division of the retromandibular vein to form the common facial vein and drains into internal jugular vein. The facial vein in the face does not have any valves, which is another factor which creates a tendency towards spread of infection both up and down and from superficial to deep. Close to its termination, the common facial vein may also receive the superior thyroid veins or the vena comitans of the hypoglossite. Now if we look at this in another picture, this picture is from an older edition of Gray's Anatomy. If we look at it from a newer edition of Gray's Anatomy, this is what the picture will look like. You see, in this picture, a bit more colorful, you can still make out the facial vein, the supraorbital and supratrochlear veins joining to form the angular vein, and then the angular vein passing, taking on the veins of the nose, upper lip, lower lip, and then joining with the anterior division of the retromandibular vein. You see here the retromandibular vein has formed. This is superficial temporal vein in the parotid. This is the maxillary vein. This is retromandibular vein, anterior division, posterior division, anterior division with the facial vein, common facial vein, posterior division with the posterior auricular vein to form external jugular vein. Now if you would just spare some time to take a look at the lymphatics of the face. See, this is the lymphatic drainage picture of the face, and in this picture you can make out that the lymphatic drainage of the face can be divided into certain segments. If you look at this first segment, that is the central part of the lower lip. The central part of the lower lip, the lymphatics drain into the submental lymph nodes over here, and because the two submental lymph nodes are close together within the submental triangle, there is cross connection between the lymphatics of the right side and the left side. Now this is the first segment of the lymphatic drainage. Beyond this, if you look at the second segment, which constitutes the lateral half of the lower lip, the whole of the upper lip, side of the nose, and half of the eyelids, and going up to the root of the nose and part of the forehead. This entire block is draining into the submandibular lymph nodes over here. So here you can see three submandibular lymph nodes, small submandibular lymph nodes, and these submandibular lymph nodes are draining a wide area. Lateral half of the lower lip, whole upper lip, major part of the cheek, ala, side of the nose, bridge of the nose, root of the forehead, and medial part of the eyelids. This entire block drains into the submandibular lymph nodes. Not only that, the submandibular lymph nodes receive afferents from the submental lymph nodes. So the submental lymph nodes partly drain into deep cervical lymph nodes and partly they drain into the submandibular lymph nodes. Now if you look at the third segment, this is the third segment. The third segment includes the lateral half of the eyelids and the posterior part of the cheek, the temporal region, and part of the forehead and the root of the nose. So the root of the nose and this part of the forehead drain partly into this pre-auricular or parotid group of lymph nodes and partly into the submandibular group of lymph nodes. So this segment is for the drainage into the pre-auricular or the parotid group of lymph nodes. And you can also make out that on the way some of these lymphatics are encountering also the buccal group of lymph nodes for the submandibular group and the superficial parotid nodes for this group. So this is for parotid group of lymph nodes, this is for submandibular group of lymph nodes, and this is for submental group of lymph nodes. And behind over here, behind the auricle, you already know from scalp, you have the lymphatic drainage into the post-auricular or mastoid group of lymph nodes and the occipital group of lymph nodes. That is enough for now.